Hi, I'm Dr. Patrick Brandon. I'm a physical therapist at Optimum Performance Therapy Clinic. I have over 29 years of experience as a physical therapist, and I've treated thousands of patients for back pain and various other problems. I was recently introduced to the McKenzie method of evaluation and treatment for patients with neck and back pain. And when I was introduced to this, it changed my practice. I have found that patients get better quicker with this method. I am one of 7 certified McKenzie therapists here in El Paso, Texas. And it's amazing technique that we have learned over time. It's a validated technique that will help patients get better. Traditional physical therapy, chiropractic treatment, massage, injections, a lot of those fail to resolve patients' pain. And what we have found is that the McKenzie method of evaluation and treatment has significantly changed my practice to get patients better in a quicker manner. The topic that we're going to talk about today is understanding back pain and finding a directional preference for a patient to move in to get rid of their pain. Simple facts that we should know is that back pain is very common. It's normal to have back pain. 80% of the population actually has had back pain at one time or another. But $50 billion has been spent on back pain. And what we have found also is that the most common visit to a physician's office is for back pain. So the good news is, however, is that 75% of patients can resolve their pain with treatment, and specifically the mechanical diagnosis and treatment of the McKenzie method. There's 2 types of back pain that people will have. You may have a mechanical back pain or a non-organic back pain. The mechanical back pain is something that just seems out of place. We move differently, or we're having difficulty because some structure is not moving properly. We might have good days or bad days, some days when you wake up and you're really stiff, other days when you're not. There's non-organic pain that is caused from more serious conditions, and those conditions would include like an infection or fractures or cancers. Those will not respond well to the mechanical therapy that we are providing, and those patients would respond probably better to a surgical procedure if that is the case. Now, a few things about, so we can learn about the anatomy of what's going on in the spine first, and then we'll talk about how we can treat that. In the spine, we have the curvatures in the spine here, where you have an inward curve of your lumbar spine, an outward curve of your thoracic spine, and an inward curve of the neck area. Those curves are normal, but what happens when we have back pain is this curve, or the C curve, that we have in our lower back will oftentimes be reversed, and we have a slouch posture. So this is called a lordosis. The lordosis, we lose that over time. It's important to maintain the lordosis so that helps protect the back and the disc. So this is a model of the spine and the disc. The disc is like a jelly donut. This central portion here is called the nucleus. It's very fluid and it moves back and forth in different areas. The nucleus sometimes will have a little fissure in it, and what that fissure will cause is that leakage of the disc material, and that disc material goes into the spinal canal. It will sometimes just be a small little bulge, and you can see with this model here, this is just the bones here, and then you have the disc. The disc will also sometimes push posteriorly or backwards, and that will posteriorly, and what that will do is that will sometimes pinch on the nerve and cause the nerve damage. So if we flex forward and we bend forward, that bulging of the disc could be a little bit of a bulge, or it could be a big bulge. The amount of bulge on the spinal nerve that comes out will sometimes cause leg pain, or what we call and refer to sciatica. The more that nerve is being pushed on, the more distal the symptoms will be. We'll have foot drop, or the foot doesn't work properly. You'll have numbness and tingling in the feet. So as we flex forward, we have more of that bulging in the disc. If we can eliminate that bulging of the disc by keeping our spine in a neutral position, that is what we're really shooting for throughout the day. So the origin of pain that we have often is coming from different sources. There's muscles, there's ligaments, there's tendons, there's all kinds of things that are in that area that will cause pain. And it makes it very difficult for us to determine the source of that pain. So what we have to do is determine the source of the pain to be able to treat your symptoms. They did a study in 1999 where they found that most back pain was caused by the lumbar disc, and most sciatica, or pain that goes down the leg, is caused by a compressed nerve root. What we as McKenzie trained therapists will do is we'll do an assessment, a mechanical assessment, and find a directional preference or a movement that will reduce or centralize your pain. Centralization is a phenomenon where the pain goes from the leg or another part of the body and goes into the center of the back. So we look for directional preference that will decrease the patient's pain and put those joints back into their normal positions. Sciatica is normally caused by a pinched nerve, but you can also have sciatica that is caused by different structures, and those could be a bone spur or even a growth that's on the spinal cord or in those areas. Again, these people would respond better to surgical intervention, and they will not respond to the mechanical diagnosis and therapy that we would be providing. So the phenomenon of what we talked about was centralization. Centralization is when the pain goes from one area to the center of the back. And Blue Cross Blue Shield of Florida, they did a study and they found 100 patients that did not have any symptoms of back pain or problems or pain. They did MRIs on these folks, and what they found was 65 out of 100 of these adults had some type of abnormality. That abnormality ranged various things, specifically osteoarthritis or a herniated disc, and also stenosis. So these findings makes it very difficult for us because, again, 65 out of 100 non-symptomatic patients have had abnormal results on an MRI. So when a patient comes into my office and they say, oh, I have an MRI that shows I have a herniated disc, that may not be the source of their pain, as that study indicates. So we need to find the true source of the pain with our repeated movements and mechanical diagnosis. Again, here's another study that they've done, and when they do herniated discs and maybe a stenosis, they found that obviously these things have been going on for several years and they don't change. So how do we explain that we have good days and bad days? If the stenosis is still there or we still have that herniated disc, is that really the cause and source of our symptoms? So it's an interesting phenomenon that relates to the movement of the spine. So the McKenzie method of evaluation and treatment, specifically known as the MDT, Mechanical Diagnosis and Treatment, is a validated assessment process that we identify problems in patients and see how they rapidly respond to special movements or postures. It's an assessment, treatment, and prevention. So it's more than just exercises that we do. The examination is pretty simple. What we do is first, we listen to the patient. We listen to their symptoms and what makes them better, what makes them worse. We'll also take a very extensive history, and that history may guide us to a certain direction that we want to move that patient into, whether that be in flexion or extension or maybe in a side motion that we will talk about later. We also do a computerized study of a patient in our office, and we'll take a patient and we'll take a picture of them. And this is a great example of a patient that came into our office with her posture looking like this. And after we were finished with her treatment, we were able to get her standing straight. So the before and after pictures of this patient are just amazing on how well the mechanical treatment can help a patient. So once we can find the directional preference of the patient, then we can also move forward and work with them and treat them. Research has found that if we are able to find a directional preference, 90% of patients that have an acute onset of pain get better, and 50% of patients that have a chronic pain will also improve and resolve their symptoms. So if we can find a directional preference and we can centralize their pain, then that shows that we're going to have good outcomes and a good procedure with that patient. They found in studies of 21 out of 23 studies, if you can find directional preference and centralize the pain, patients will get better. Another aspect of the McKenzie examination is that we will do a home exercise program. We give the patients exercises to do in the direction that will resolve their symptoms 2 to 3 times a day, every 2 to 3 hours. And we will also work with them on prevention. Part of that prevention is using a lumbar support to maintain that curvature in the lumbar spine. So we'll use this back support, put that in the patient while they're sitting, and then that helps to maintain that curve and decrease the pain. So when we are looking and evaluating posture, what we want to try to do is, you can see how she's sitting in a slouched posture. So we want to first sit up nice and tall, and we put the curve in the back here. And then what I want you to do is I want you to scoot your back all the way back, your butt all the way back, and then just lean forward just a hair. We put this lumbar support in here, and that helps maintain the curve. And then we're going to sit up nice and tall. And then that helps keep that alignment of the back when she's in a sitting position. So that keeps that C curve, and then the alignment of the neck and the back are all in perfect alignment. So the centralization phenomenon is something that neurosurgeons are very aware of. Basically, if you have pain that is in the back and then the patient develops leg pain, that means that the patient is getting worse or not getting much better. If the pain is in the leg and now the pain starts to move up towards the center of the back and resolves, that means the patient is getting better. So these are things that we look at from a physical therapy standpoint. Now, daily activities will involve a lot of flexion. Everything, if you think about what you do throughout the day, we're in a flex position. We mostly sit in our chairs with slouch posture. You go home, you sit in your couch. Gardening involves bending forward, cleaning, putting on makeup in the morning, brushing your teeth, putting your shoes on at the end of the day. So everything involves flexion. Now, sitting is the new smoking, which basically means that it's really bad for us. And so they have done a study also where they have found that 3,500 times a day we flex, and we're in a flex position, which is obviously not a good thing. But what's interesting is why is it that when we bring our knees up to our chest, that feels so good? Feeling good and good for you are not necessarily the same things. And so sometimes those are actually detrimental to our progress. So patients that come into my office, they're in a very bad predicament. They're trying to lose weight because they have pain in their knees, and they try to exercise, but they can't exercise because they have pain in their back. So it's very important for us to try to eliminate the source of the pain and to try to get them better so that they can go on with their life and do the things that they want to do to get better. So if we know beforehand what we can do to prevent the pain from coming, so if we're gardening or we're taking a long drive, if we do something before that activity, we can prevent the pain from coming on down the road. So if we want to restore function, we first have to determine the directional preference for a patient. Once we find the directional preference, there's studies that show that this is a great outcome for us, and we will be able to restore patients back to their normal function. So we can find the right exercise for them, we can return them back to their normal activities that they enjoy. So in summary, the low back pain population is very common. 80% of the people have lower back pain at one time or another. This is very normal. However, when it limits your function and it becomes a problem that it's constant throughout the day, this is where a physical therapist that's trained in the McKenzie method can help. Lower back pain can be aggravated or caused by prolonged sitting or prolonged postures. So these are the things that we teach patients. Mechanical pain will change with repeated movements at end range movements. So these things will teach patients, and as we do those exercises, they feel better. Centralization is a strong indicator and predictive value for patients to get better and return them to normal function. The take-home point is, if we remain active, movement is the best exercise, and we want to try to improve that by doing repeated movements and staying active. It's important that you see a McKenzie trained physical therapist for your problem. This will help find a directional preference for you and will instruct you in repeated movements to eliminate that pain. And we don't want you to rely on someone else to fix your problem. We want to teach you the secrets of self-adjustment and how you can treat yourself. If you have any additional questions or you would like for us to find your directional preference, contact us at our office. We're located on 1400 George Dieter on the second floor of the building and Suite 200. Our office phone number is area code 915-849-5112. You can also visit us on the web at www.optcep.com. Visit our various social media sites, and we love you to like our Facebook page also. I'm Dr. Patrick Brandon, wishing you good health.